Hey, what's going on? So lately I was really enjoying my new hairstyle, this kind of long hair, and of course the barbers are closed. There's not really much, many options, but I'm looking forward to get my haircut already because, the sides are a little bit getting bulky and like they sticking out. I really need to make them flat so it looks pretty decent. So nevertheless, looking forward for the haircut. But in the meantime, I got an interesting question that I would like to address, and it's actually quite common. So many people asking me, why did I have the hair transplant only until like a halfway there? And it's like a proper line that is separating transplanted and non-transplanted hair. And there's a few reasons for this. But let me first read the actual comment because I think it's a really good educational opportunity. Not sure why this popped on my list, but you wasted your money, bro. When it's short, it looks like transplant, but when it's long, it looks like toupee. And why did they leave a horizontal bald spot right on top of your head? Legit question. I'm glad you asked. So first and foremost, I really appreciate any kind of comments, especially this kind of, because it just shows what people know about hair transplants, what they don't know. And he continued saying that his friend went to get a hair transplant and it looks unnatural, and he continued losing hair and he lost his transplanted hair. We all know how it goes, right? If you don't take any medication, if you're not a good candidate for surgery to begin with, that's all basically side effects of the surgery. So, but again, that's clearly not the case for every single person. I understand what this person is coming from. Nevertheless, why did I have the transplant only in the front with a straight line and not going any back, further into mid-scalp and crown? And why it was not done like a transition into this, area? And the reason is very simple. Because I had quite a lot of miniaturized hair in that area. So any good surgeon would try not to go into this area to begin with, because with surgical intervention it could basically induce shock loss, and it could be a permanent shock loss, which is not great because the surrounding native hair are very thin and miniaturized. At this point they're really weak, so any surrounding trauma, even though it's going to be done precisely, still the surrounding trauma can cause shock loss, which can be permanent, and they might not ever gonna come back. So this is reason number one. I needed to give some time for a medication, which were finasteride and minoxidil, to give a bit more time and see how we're gonna progress. Of course, I decided to ditch minoxidil immediately after this transplant, never come back. At that point, that's another topic. But finasteride, I was at that point only 6 months. So we agreed both with my surgeon that I'm gonna spend some more time, at least 1 year, and reassess. Let's see how finasteride gonna work. Possibly could maybe regrow all of this area so I don't need a second hair transplant. Reason number two is because I had discussed with my surgeon already a two-step approach. Because I'm Norwood 5, my balding area is pretty big, alright? So it's pretty much impossible to create a really good looking dense result overall in just one surgery. Especially considering my fine type of hair, which is like 50 microns, while thick caliber hair guys have up to 100 microns. So imagine twice thicker hair. You would require much less grafts per centimeter square to achieve dense result, hence why it's possible to cover more area with less grafts with pretty good density, which is not the case for me. So two-step approach was basically a crucial. I wouldn't be able to get away without second surgery anyways. So, we decided just to cover the most problematic area, which was frontal third, because it was pretty much 99% bald. There was literally no hair except like a little horn in the front, and that's it. So, we covered this, and aesthetically it's gonna be the biggest, difference. Because I'm gonna have a new hairline, which I've got right now. And to be honest, I'm pretty happy. So in my personal understanding, if there is no way to avoid second transplant anyways, it's better to focus mainly on the most problematic area, like in my case it was a frontal third, the hairline basically, and do as best as you can. Just dense pack it, and make it look really good and nice. So on the second surgery, you either don't have to come back at all, or just to get a minor small touch-up. Because we all know there is no 100% survival rate in any surgery with any good or bad doctor. So it can be like a little weak spots here and there, hence why most of the people would prefer to have a second transplant to kind of, make the hair transplant look perfect. So yeah, whatever you see right now, it's a result of one surgery after 1 year, a bit more than 1 year. I'm currently a little bit over 14 months after my hair transplant with Dr. Bruno Ferreira in Portugal. And second hair transplant gonna be done in June, 3rd and 4th of June this year. So roughly in 2 months. Actually, 2 months. So if you want to follow my second hair transplant journey, make sure to subscribe to the channel. And also I'm sharing different tips and tricks, not just for the hair transplant, but for hair loss. If you are about to book your surgery or you're waiting already for your surgery anytime soon, definitely subscribe, because I'm gonna be releasing so much new content on a daily basis after my second transplant, so you can know basically, and you can learn what to expect immediately after surgery, the first day, second day, whatnot, because I've done it already once and I know very well what to expect the second time, and I know what to focus. So a lot of good information. Thanks so much for watching, and I'll see you in the next one.